Hello everyone, this is Johnny Knuckles. Today we're going to be talking about coronary heart disease. Coronary heart disease is caused by the plaque buildup of the walls and arteries that supply blood to the heart and other parts of the body. Plaque is made up of deposits of cholesterol and other substances in the artery. As plaque builds up in the arteries of a person with heart disease, the inside of the arteries begin to narrow, which lessens or blocks the flow of blood. Plaques can also rupture or break open. When they do, a blood clot can form on the plaque, blocking the flow of blood. Heart disease is the leading cause of death of both men and women. More than half of the deaths due to heart disease in 2015 were in men. About 630,000 Americans die from heart disease each year. That's 1 in 4 deaths. Coronary heart disease is the most common type of heart disease, killing about 366,000 people in 2015. In the United States, someone has a heart attack every 40 seconds. Each minute, more than one person in the United States dies from heart disease-related event. Heart disease is the leading cause of death for people of most racial and ethnic groups in the United States, including African Americans, Hispanics, whites. For Asian Americans or Pacific Islanders and American Indians, Alaska Natives, heart disease is second only to cancer. Heart disease costs in the United States about $200 billion a year. That's $200 billion with a B. This total includes the cost of health care services, medications, and lost productivity. Coronary heart disease is a growing worldwide health problem that is expected to be one of the leading causes of death well into the future. Risk factors for developing coronary heart disease are high blood pressure, high cholesterol, tobacco use, which also includes smokeless tobacco, diabetes, and a strong family history of heart disease or obesity. Many of the contributors to heart disease can be prevented by eating a healthy diet low in saturated fats and trans fats and cholesterol, limiting salt and sugar, and a diet that's high in fiber, maintaining a healthy body weight, getting enough physical activity and exercise, which helps to maintain weight, lowers blood pressure, cholesterol, and sugar levels. The Surgeon General recommends 2.5 hours of moderate intensive exercise every week. Not smoking or using other forms of tobacco, limiting alcohol use in men to 2 drinks a day, and women it's 1 drink a day. The treatment for coronary heart disease, once it has been diagnosed, include heart-healthy lifestyle changes, medications, medical procedures and/or surgery, and cardiac rehabilitation. Treatment goals for lowering the risk of coronary heart disease include lowering the risk for blood clots forming, preventing complications of coronary heart disease, reducing risk factors in an effort to stop, slow, or reverse the buildup of plaque, and relieving symptoms, widening or bypassing clogged arteries. Management of coronary heart disease, you need to commit to a lifestyle changes, medications such as cholesterol modifying meds, a daily regimen of aspirin, beta blockers, calcium channel blockers, nitroglycerin, ACE inhibitors, and ARBs, angioplasty, and stent replacement, coronary artery bypass. Only 7% of living Americans have coronary heart disease. But hold the phone. We said earlier that 1 in 4 Americans die from coronary heart disease. How do we reconcile that? Well, just think, if only 7% of Americans have coronary heart disease right now, but 1 in 4 die, then those that would be living are dead now. So prevent coronary heart disease, eat right, exercise, and take your meds. I want to thank a few people: the Center for Disease Control, Atlas of Heart Disease and Stroke, National Health and Blood and Lung Institute, Psychology of Health and Medicine Magazine, and my friend Raina Lane. Thank you, everyone.